My name is Eric Kress, K-R-E-S-S. My name is Eric Kress. I am a family physician in Missoula, Montana. I have practiced family medicine in Montana for 26 years. I am appearing before you today to present my testimony why I believe you should vote against passage of House Bill 505. First of all, I wish to thank all the members of the Senate Judiciary Committee for listening to my views on this issue. The matter before you is whether to vote for House Bill 505 or not. The bill clearly states that any doctor, nurse, or family member who assists a patient in obtaining an aid in dying prescription will be sentenced to 10 years in prison and fined $50,000. So you may be wondering, what kind of doctor is it that you will be sending to jail? I stand before you today and state that I am that kind of doctor. I have written an aid in dying prescription on 3 occasions. This all occurred since the Baxter decision by the Montana Supreme Court that made it legal to do so. In order to give you a clear understanding of my practice, I would like to describe it to you. 95% of my work, I am a good old family doctor, like my dad was before me. I have delivered hundreds of babies. I have diagnosed hundreds of cancers. I have prevented thousands of deaths from strokes and heart attacks by treating diabetes, high blood pressure, and high cholesterol. In addition, I have treated many cases of suicidal patients with depression, and I have prevented many suicides from happening. I am a state school educated person, having received public funded education throughout my career. That includes the University of Montana and the WWAMI program through University of Washington. I thank you and all the taxpayers of Montana for making this possible. In addition to the above work, I estimate that 5% of my work over the last 8 to 10 years has been devoted to palliative care. In 2008, I received a board certification in palliative care, acknowledging my time spent and special knowledge in this area. With the above background information in mind, I wish to discuss with you why I feel you should vote against House Bill 505 and vote for preserving a patient's right to choose aid in dying when faced with a terminal disease. Today, I'm going to give you a glimpse into what it is like to be on the front lines of palliative care. To be the person in the room that the patient, the family, and other healthcare providers looks to for advice when considering their options for care at the end of life. I have been that person on numerous occasions. Most of the time, compassionate and time-tested palliative care treatments from hospice healthcare professionals will be all that is needed to guide the person through the dying process in a comfortable fashion. For some patients, however, this will not work. Of these patients, some will have a, quote, hard death. By this I mean that despite the usual 4 to 5 medications used in palliative care, nothing is working. We then have to resort to more and more powerful medications and delivery systems until we enter the realm of what we call terminal sedation. I would say a few percent of people need this level of intense palliation at the end of life. This could involve the use of a general anesthetic. Undoubtedly, these options can shorten lives by hours, days, or weeks. I have never known anyone who has witnessed a person in a pain crisis at the end of life to express regret that terminal sedation was used. In fact, they have universally been thankful and grateful that this option existed. Another group of people wish to have more control over the timing and manner of their death and seek me out for advice on the option of aid in dying. Over the years since the Baxter decision, approximately 10 people have come to me asking about this. Of these 10, I have written prescriptions for 3 patients for aid in dying medication. All 3 patients chose to utilize this option. 2 of these 10 patients, while I was sort of thinking about whether I do this or not, they stockpiled their medications and took a lethal dose to hasten their death and relieve their suffering. Of these 3 patients that I did write a prescription for, all were male and all were rugged individualists. They all were very uncomfortable with the thought of not being able to care for themselves and having family members do personal hygiene, even though all of them had loving family members very willing to do so. All of them stated that it was very important to die with dignity and avoid the personal indignity of having others care for their basic bodily functions that we all take for granted. And this was all while they were going to die in a short time anyway. One man was poor. One man was middle class. One was rich. 2 had advanced esophageal cancer. One had ALS or Lou Gehrig's disease, which, as you know, is a progressive neurologic disease that, Lou Gehrig, the baseball player, had. All 3 had more than 2 doctors who had rendered opinions that they were terminal and had plentiful diagnostic testing confirming this opinion. All of them were of sound mind and knew what they were doing. None were depressed. All of them expressed that they had no wish to die. They all loved life and would much prefer to live, but not in the miserable condition that their terminal disease was dictating them to have. Soon after the Baxter decision, a man with terminal and advanced ALS asked to see me. He was on hospice and wanted me to prescribe aid in dying. He was a wealthy, self-made man who had been incredibly active both in his profession and his personal life. The court decision being new, I was hesitant to write a prescription. This man was not used to taking no for an answer. I needed time to think about it. He dressed me down like a Marine drill sergeant. He told me, in no uncertain terms, that I was a coward. This once proud man used to be well over 6 feet 2 and 200 pounds of muscle. He had been completely self-reliant. He had now been reduced to 120 pounds of skin and bone. He had a tube feed that still choked quite often and could not walk. Despite this, he kept trying and was falling constantly. He would often be found weeping and bemoaning the miserable fate that had befallen him. On a daily basis, he begged his wife for medication that would end his suffering. Several weeks later, he managed to stockpile enough of his narcotic medications and to put down his feeding tube and end his life. But this man had affected me. What kind of man or doctor am I? Or, Dr. Kress, are you going to be a man of your convictions and be brave and do what it takes to help people at the end of life? I spent many sleepless nights after this patient died pondering this question. Sometime after this, a patient of mine was found to have terminal esophageal cancer. He asked me for an aid in dying prescription. He wished to have it available for when his suffering became severe. After meeting with him on several occasions and making sure of his appropriateness for an aid in dying prescription, I wrote him a prescription and he filled it. He was personally greatly relieved at having this option available. He and his family thanked me profusely on every occasion I met with him. I also visited with him at his home every 2 to 3 weeks to see how he was getting on. He also had other members of the hospice team visiting him regularly and greatly enjoyed our company. After about 2 months, he began experiencing increasing pain in the chest, where his cancer was undoubtedly growing into surrounding tissues. He started taking more narcotics, and we gave him steroids to reduce swelling of the tumor. This helped for 2 to 3 weeks. But then it became obvious to him that his pain was on an unrelenting increase. He could also tell that he would only be able to swallow for a short time before his esophagus closed off. He decided it was time. He asked his sister and 3 of us on the hospice team to be present at his death. We explained to him that we would not aid him in the administration of the medication in any way. He wanted us to be there so he wouldn't be alone. And you know, we didn't want him to be alone either. No one wants to be alone at the time of their death. He prepared the medication by mixing the contents of about 100 capsules of a sleeping pill in 8 ounces of water and some cherry syrup. Then he opened up a bottle of his beloved Guinness and insisted we all join him in a toast. He then thanked me again for having the courage to write this prescription when many others will not. He then told me if there's anything I can use from his case to further the cause of making aid in dying available, that I please do so. Then he sat in a comfortable high-back chair. He drank the medication. In 1 to 2 minutes, his speech was slurred. In 2 to 3 minutes, he was asleep. His respirations had stopped in 5 to 6 minutes. In 12 minutes, his pulse was absent and he had no heart sounds. All of us present at his death were amazed at how peaceful it was. I had no sleepless nights after this man's death. In fact, I am proud that I had the courage to do the right thing for him. So to summarize, the doctor that sits before you, the doctor that would be thrown in jail if House Bill 505 passes, is a doctor who is proud of his work. He is grateful to the state of Montana that has invested so much in him. My suffering patients and families of those who suffer are grateful to me. All of us are grateful that our government, through the Baxter decision, has not been controlling our deeply personal decisions at the end of life. I urge you to vote against House Bill 505, a bill that would be the government taking of a personal freedom that the citizens of Montana now enjoy. I sincerely thank you for listening to my views on this issue. I have copies of my testimony and we'd be glad to take questions later.